Hi, I'm Dr. Chaitanya Rao, your Sinus Doctor. Today I'm going to talk about a problem which is frustrating not only for the patient but also for the ENT surgeon. Resistant sinusitis, also known as a refractory sinusitis. So these patients, they take multiple courses of antibiotics, they use saline sprays, they use steroid nasal sprays, they even undergo nose and sinus surgery, but the sinusitis issues still persist for them. So why does this happen? What are the causes for the resistant sinusitis or refractory sinusitis? Number one is allergies and irritant exposure. If you're allergic to something and you keep exposing to these substances repeatedly, your nose and sinuses will keep responding by swelling up, by producing excessive secretions. Number two, biofilms. So let me explain you biofilms in a very simple language. In biofilms, the bacteria, they form strong bonds with one another and they line the nose and the sinus cavity. They also produce a gooey substance which keeps them firmly attached to the mucosal lining of the nose and sinuses. And these biofilms will not move even with repeated saline washes or even with repeated course of antibiotics. The antibiotics cannot destroy the biofilms. And as long the biofilms are persisting, patient will keep experiencing nose and sinus complaints. The third common cause is physical obstructions. When there is a bend in the nose, such as a deviated nasal septum or the inferior turbinates or the middle turbinates, the swellings inside the nose, they have grossly enlarged in size. The nose and sinus openings or the drainage pathways will not improve with any number of medications. So these physical obstructions keep blocking the nose and sinus drainage pathways. The next common cause is lowered immunity. See, in our body, there are a number of bacteria, a number of fungi which are always there, but our immunity checks it and prevents these bacteria or fungi from overgrowing and causing an infection in us. When there is a lowered immunity in our body, what happens is these bacteria, these fungi, they start overgrowing and they start causing a full-blown infection. So as long as you use an antibiotic, you will feel better, but once you stop it, immediately, because your immunity is not good, the infections start flaring up again, and this is one of the common causes for the resistant sinusitis. The next common cause is fungal infection. The fungi, until they are completely removed from your nose and sinuses, can easily grow back and cause repeated sinusitis issues. So any number of antibiotics, any number of antifungals you use are not going to help you get rid of the fungal infections. Only a good nose and sinus surgery with thorough washes of the nose and sinuses can get rid of these fungal infections. So how do we treat these patients who have this resistant sinusitis? Number one, if we see that the patient has allergies, we try to identify what he is allergic to and advise the patient to avoid those allergens and also prescribe anti-allergic medications like antihistamines and steroid nasal sprays for these patients. Number two, in the culture sensitivity of the pus what we send, we identify what is the bacteria which is causing this infection in this patient by means of culture sensitivity, and we understand even in the culture sensitivity report what antibiotics work on this bacteria, and we prescribe these specific antibiotics for the patient. In case of patients in whom we find that the physical obstructions is the cause for the recurrent sinusitis or this resistant sinusitis, we advise surgical correction of these obstructions. And in patients who have low immunity, we, like I told you, we identify that status in the blood test. We suggest an immunologist consultation and we try to improve the immunity of the patient. And by improving the immunity of the patient, he can himself fight the infections, and this will get rid of the resistant sinusitis. Also, in all these patients, we advise them to change their lifestyle a little bit. We advise the patient to stop smoking if he has a habit of smoking. Not only actively exposing to smoking, he should also avoid passively exposing to smoking, that is, living around the people who smoke. Also, we advise the patient to always wear a mask when he is entering dusty environment or environment where there is a lot of fine particulate dust, such as in construction industry. Also, we advise the patient to have plenty of fluids because moisture in the nose and sinuses is very important to keep the nose and sinus healthy. Also, we advise the patient to maintain very good nose hygiene. That is, if he goes to any area where there's a lot of dust or where there is a lot of fine particulate matter, such as what we see in construction environment, we advise the patient to wash his nose once he comes back to his home from that environment. So I hope you have understood what is this resistant sinusitis, how we diagnose this condition, how we treat this condition. If you're one of these people who have used multiple antibiotics, have undergone surgery for sinusitis, and are still suffering with these symptoms of sinusitis, please meet a nearby ENT doctor. I'm sure he will take the best care for you. If you still have any doubts about this topic, you can mention in the comment section below, and I'll be very happy to respond to all of your queries. Thank you so much and namaste.